Hello guys, you're with Evo again, and today I'm going to talk about the last few things I've learned on my day one in nursing school. It's going to be temperature, oxygenation, and pain. For the rest of the videos about blood pressure, respiratory rate, and pulse, you can check some of the links here and here. I'll make sure I post them. And now returning back to temperature. So the temperature basically of the body is the amount of the heat that the body produces versus the amount of heat the body loses due to some external factors. Currently, you see that I'm a little bit cold, like here in New England, it's kind of cold, so I put some clothes so I don't lose as much temperature. The temperature is usually divided into two places that can be measured, like two big things. It can be either superficial, the one can be found in the mouth, the skin, or the axillary, or it can be core, the one can be found in the rectum, in the temporal and tympanic. So basically you should be able to measure the temperature and like see if it's in appropriate range, and depends on the site you measure it, you're looking for different variables. Usually the core temperature is about a degree to half a degree Celsius higher than the outside temperature, the superficial. And as far as temperature, you're looking for a temperature in a range from 36 Celsius to 38, and that's basically 26.8 to 100.4 in Fahrenheit. You really should learn to convert those units, and I'm definitely gonna post the formula, which you're gonna see somewhere around me. And feel free to use this formula in your tests because you're definitely gonna need it. So now we're gonna look at sites that we're gonna measure the temperature. So speaking about sites that you can measure temperature, the most popular ones are the oral, axillary, tympanic, temporal, rectal, and the skin. Each one has its own advantages and disadvantages. For example, the oral one is easily accessible and it's really comfortable for the patient to get measurement there, but can really be affected by drinking hot or cold. And also, if the patient has any kind of mouth surgery or is unconscious, unresponsive, you should never measure the oral. Just look for another site. Another site can actually be axillary. Axillary is like really safe and inexpensive method of measuring the temperature, but it really takes a long time, and it may feel your patient uncomfortable for exposing like the part right here, the thorax, because you know it's really exposure. The other one that's really famous for measuring it is the tympanic one, is the one in your ears. It's really accessible, it's rapid, and doesn't need to wake up the patient if he's sleeping or not. Because in some other methods, for example oral and axillary, you should have him waking up. But the only limitation to it is it's really difficult for children under 3 years of age, just because they have their own like ear canal is slightly different than adults, so it's really hard for them. You definitely should look for another way for children under 3. Another place that's really easy and most likely you have it measured when you go to your primary care is the temporal one, is the one right here. It's really easily accessible, it's rapid, it's comfortable. Basically the only downfall is the fact that it's affected by sweat and if always some hair on the way, and different thermometers basically require different nurse skill, but from all the places this one is the most effective one. Another place that you can measure it is the rectal one. It shows a really good core temperature, but it's really uncomfortable to have it like put in your ass, in your rectum, you know. So the last place I'm gonna talk about is the skin. The skin, the good thing is about it, it's really safe and it's inexpensive, but unfortunately it takes a really long time for the measurement compared to the other methods. So going to my favorite is gonna be the temporal one. As I said, rapid, comfortable, easily accessible. So moving on to type of thermometers we have. There are different types of thermometers that use to measure the temperature. There can be either electronic, temporal. Those are the most commonly used. Then you're gonna find a tempatic, which is not as commonly used because it's a little bit more expensive, and the dot, which is really old style, along with the mercury thermometer, which you're not gonna find somewhere in modern hospitals, just because of the risk of the mercury hazard. So it's really a thermometer, but you still might find in some patients' homes, and definitely should aware them of the facts and like how much danger it is. So definitely stay away from it. And this is all from temperature. Feel free to let me know if you have any questions, because I'm gonna move on to oxygenation. So speaking about oxygenation basically I'll not go into detail how exactly it works. The only thing you should know as a nurse is the fact that it measures the oxygen saturation in the arterial blood, and if it's above 95 you're all set, you're good, you're in the normal range. But if it's below 90 you're in a clinical emergency situation and you should get like some help, definitely. Another thing that you should do is be aware of the nails of your patient, because most of the times like people gonna put the oxygenometer on their finger because that's the most common used site. They're also for the ears and the nose, but those are pretty expensive, so we don't really use them. So as far as the one on the finger goes, you should see if their nails were done or there's something on them that can like really affect the measurement, so it doesn't like show a false result. For example, you can have a pretty much like normal walking talking patient with an oxygenation level of 74, and if you apply your critical thinking you're gonna see that most likely there's something on the nails. So that's everything from oxygenation. Then moving on to pain. Speaking about pain, whenever you're assessing your patient for vital signs, you should ask them what their pain level is. It can be from 0 to 10, while 0 is no pain at all and 10 is the worst pain they've ever felt. That's the only sign that's actually subjective and not objective as all others. And it's whatever the patient tells you. You might think that there's no pain at all, but if the patient tells you there's 10 out of 10, then definitely you should do something about that pain and make sure that you prescribe something so he feels okay. So guys, that's everything from me. That is everything from day number 1 at nursing. Please let me know how you feel about those videos, if I should move on like making them, or they're any helpful, a way to improve them, a way to add more valuable. Feel free to follow me on Instagram. I'll definitely like to see like some of your comments, videos. You can see some of my pictures. I'm trying to post something every day, so it's gonna motivate, like keep you going through that nursing program and get to that nursing degree. So thank you guys, I really appreciate your attention, and see you next time. Bye bye.